Great. All right. So sorry for having to do asynchronous on Tuesday. I said I had to make something work for a student who was graduating, and I appreciate your patience with that. So I know that Tuesday's lecture was a lot, but it was just you'll have practice with those delays in the homework that is not due this weekend, but the weekend after that. So hopefully that will help and generate some questions that I'm happy to help sort of answer there. But the good thing is, after Tuesday's lecture was sort of the last lecture that's about kind of the nitty gritty tools that we need in VinSim or Insight Maker. If you're happy with one, you can just stick with it. You don't need the other one. So in the past, I've taught both Insight Maker and VinSim together because VinSim was a lot flakier than it seems to be this semester. They've claimed to me in the past that they fixed some of the flakiness so it doesn't crash as much. At least from my experience running it on my machines where it used to crash a lot for me, it seems to be a bit better. It's still not the prettiest program in the world, but it's not so bad. And so if you've grown accustomed to VinSim and don't want to bother with Insight Maker, that's totally fine. But we just need to make sure you have access to one platform for the rest of the course. And Tuesday's lecture was the last kind of new thing that we've added, that how to find things in the platforms. And from this point on, we're kind of looking at case studies of systems that can be modeled using system dynamics modeling and how to build the formulas that go into that model. And so we should see a lot of the elements that we've learned how to use, but now combined together in more practical applications. And today's application is the first of these. We're going to do this a little bit of epidemic modeling. This will relate to the chapter that you'll read for Tuesday. So just as a reminder, that's due for Tuesday, where that one is going to talk about the diffusion of ideas through a marketplace, which ends up having a very similar set of dynamics to how disease spreads through a population. So that's kind of where we're going with this. So of course, this is very topical, right? We're in the midst of a pandemic right now. And so we feel the effects of disease spread, and we can, being able to build models to help us understand how to slow down the spread of disease or predict when it is going to, when certain events are going to happen, would certainly be useful. And if you look at patterns of disease spread in the, so this is not even COVID, this is in the 2014, an Ebola epidemic, and Ebola is there's also Ebola coming out this year, and you can see that in different areas of Africa, you've got a very similar infection peak. And if you are looking at positivity rates and things like that for COVID-19 in this country or in the world, you see similar sorts of patterns. So because you see these similar patterns, that kind of gives us an idea that that these patterns are endogenous, that if you have picked a few important internal variables in a system and you wrapped a boundary around that system, then if you've figured out how to connect those system variables up right, you should be able to generate similar curves like we see in real world data. And if you can do that, then you've got your own petri dish or playground or sandbox, in which case you can experiment with if we quarantined at a particular time or another time, or if we could manage to get the infectiousness of this disease down to a particular amount by wearing masks or something like that, or if we could make the mortality rate, if we cut it in half or cut it in by a quarter, then what effect would that be? These are the sorts of things these are the sorts of things that we can hopefully do inside a simulation that would be very difficult to do in real life, but give us a lot of useful information about things that we could then take to policymakers and inform them. So as a quick example of this, back in May of last year, when there was still a lot of confusion about what was going on, I wrote a Medium article where I just took the estimates of these types of models that we're about to learn today from parameters of these models from the CDC, and back in May, the little back of the envelope calculations I got from model no more complicated than the models that we use here, predicted that at this time this year, if the US did nothing, if they just let things run, we would have about 500,000 deaths. And that's my model, I think, predicted 505,000 deaths. And it wasn't my model, it was the models we learned today, just using numbers that came out of the CDC. So I was doing the same things that, that people informing policymakers were doing. And back in the, and that seemed like a big number back then, a year ago. And then now we're here today and we've got, whatever, 550,000 deaths in this country. And so it just shows how these models can, if we build strong, robust, rigorous models, then it actually can give us a lot of power into understanding what's about to come. And if we can build our stakeholders' trust in these models, then hopefully we can get them to take action when there's time to take action. And if you look across different countries across the world, you see different responses to COVID and you see very different outcomes. And I think a lot of that has to do with the will of the people and the will of policymakers to trust models. All right, so there was a private message that was sent to me in the chat. And I just want to respond to that real quick to the students into that. I'm willing to take a look at that. Send me an email and I will, with the exact same text you sent me with a private chat, and I'll take a look at that. All right, so let's see this in a little bit more concretely what we're talking about here. So about every type of disease that you can think of has some elements of this basic model that in epidemiology refers to as the SIR model, or the susceptible, infectious, recovered model. Not all diseases fit this perfectly, but all of them share some aspects about these, and then you can embellish different parts of them to sort of, to kind of customize this to different diseases. And so, but this is kind of the basics that we start with. So if we are on the modeling continuum, this is going to be closer to metaphorical. It'll hopefully be in the kind of more illustrative section. And then as you start thinking about particular disease aspects, whether it be Ebola or SARS-CoV-2 or whatever, then you can start adding more things to this model, getting it closer and closer to the analogous side, adding more realism. So, but I'm starting with the metaphorical side because it's more generalizable. It applies across many diseases. At least, it might explain 80% of the variants that you can see. And if you want to get closer to really understanding a particular disease, you're going to have to add more components to it. And I might invite you to do that for your final projects. So, and I've had people do that in this class before, is they've taken a basic SIR model like this one, and they've added a few more things to it and showed that when you model this other thing, maybe it has to do with whether recovered individuals can become infected again, or those sorts of things, then how does that change the outcome, or how does that change intervention strategies? That's a great thing you could model in a final project. All right, so let's get into it. So basically, this model of disease spread, instead of modeling every single one of the 350 million Americans, for example, or the whatever 7.5 billion people on this planet, it basically says whatever population you're looking into, we're only going to focus on categories of people who are susceptible to disease, people who are currently infectious. And so the shus there means that they are spreading disease. So they've got the disease and they're spreading it to others, and people who have recovered. And so these are people who are immune to spread. They don't spread the disease and they don't get the disease spread to them. They don't have any symptoms. And so we build a model which focuses on how these three populations change. So this is a so-called compartmental model where the state variables that you have picked out are like three buckets, and they're compartments on which you take a larger population and you divide them into those three buckets, and you study how things move from bucket to bucket based on how full each bucket is. And so if everybody is susceptible but nobody's infectious, then you'll never get anybody moving from the susceptible bin to the infectious bin, and then you won't ever get anybody moving into the recovered bin. Once you have a few that are infectious, then those few that are infectious will pull over some that are susceptible into the infectious bin, and then that eventually will pick up like a snowball effect. But then hopefully these infectious individuals then become recovered individuals eventually, and that process will then deplete the infectious group. and then hopefully get rid of the infectious group so that you can have a equilibrium population of some who are still susceptible and some who are recovered and none left over that are infectious. So that's kind of where we're going with here. So these three dynamic variables are our stocks. They are the things that change over time. They are the things that in our bookkeeping sheet, we keep track of at every instant of time. How many people are susceptible to disease, how many people are spreading disease, infectious, and how many people have recovered from the disease. We keep track of those things at every instant of time. That's what makes them stocks. And if we know how many people are susceptible, infectious, and recovered at any time, we can then estimate the flows. So what are, based on the current population of susceptibles and the current population of infectious individuals, then if there's a lot of susceptibles and very few infectious, then we might be able to say that there won't be a very large flow of infections because there aren't that many people who are spreading the disease. But if it goes the other way around, where we've got maybe an equal number of susceptible and infectious, then in that case, there's a lot of susceptibles who could get the disease and a lot of people who are spreading the disease who could give it to them. So the infection rate might increase. And then if there's a lot of infectious but very few susceptibles, then the infection rate will decrease again because when these infectious people are moving around, they're just bumping into other infectious people. It's really hard to find a susceptible. So based on the number of people in these three bins, we can figure out at any instant of time what is the rate of change. So how many infections are we getting, which is a movement of people from the left bin to the middle bin, and how many recoveries we're getting, which is how many people are moving from the middle bin to the right bin. So we put those stocks and flows together, and we're going to get a stock and flow model that looks a little bit like this one. And so these are our stocks and those are our flows. Now, obviously, it's missing links. And so we're going to need to then fill in the links here in order to figure out what formulas go in the infections and the recoveries. So that's going to put our focus on formulas. So before I go in to figuring out the formulas for each one of these flows, are there any questions about how I've laid out the model so far? Is it clear what I mean by we have multiple compartments of a population? We're not modeling every individual. We're just modeling how many individuals are in one of these three bins and how that number changes over time. Okay. I see some confirmation. Things seem clear. Thanks for that. Okay. I'll give it a little bit more of a pause. All right. Well, if anything isn't seeming clear, then just speak up. And if you start feeling comfortable with this SIR model, as you'll see for Tuesday's reading is not about disease spread, but the model that we'll see in Tuesday's reading looks almost identical to this model. And so you end up actually, on the metaphorical side, as you learn more models, you'll learn more families of models, and those families of models will then help you learn how to model systems that don't even seem to be related to these systems. And so think about that as you're reading for Tuesday. All right, so we now need to figure out how to build this formula for the flow rate, which is the rate of people coming out of the infectious bin. And I've got the term infected here. I'm doing that because one of the textbooks that I borrowed some images from used the word infected. Being pedantic as I am, then it's not the susceptible infected recovered model. It's the susceptible infectious recovered, because just because you're infected with disease doesn't mean you're shedding it. So technically speaking, it should be infectious. And I'm confident that the author of the book that I borrowed the images from just made a typo and nobody who was doing the copy editing caught it. But that's the reason why I use this word infected here, just to be consistent with some images I've got coming up here later. But technically this should be infectious. All right, so if I need to figure out what formula to put in here under recoveries, then I basically think about, well, for an individual who is sick, how long does that individual stay sick? And then, after that, that individual's then going to become well again and be recovered. And so what I'm going to focus on here is, on average, how long does it take one person to recover from disease? And this should remind you of our bacterial model, where the idea here is, if I know on average how long it takes for a bacteria to live, then I can build a death flow. And that death flow is going to be based on the total number of bacteria and the average lifetime. It's the exact same thing I'm doing here. Now I'm not modeling deaths, although you could add deaths in your final project. You could say, well, some people who are infected die and the other ones recover. And you could then say, well, how does that change things? That would be one modification you could think about making. And there would be similar processes here. But here, I'm not talking about deaths, but I'm talking about removal from a compartment, which is kind of like a death. And so we're saying, how long does an individual stay in the infected compartment? That's like saying, how long does a bacterium stay in the living compartment before it gets moved in the dead compartment? And instead of dead here, this is the infected compartment moved to the recovered compartment. And on average, there's whatever the duration of infection is. You could go on and you could just Google for somebody infected with SARS-CoV-2 who has COVID-19, on average, how long do they stay infected? And you might say, oh, whatever, 12 to 14 days. And so in your model, you could parameterize this as 13 days and let it rip. So what would the formula look like inside recoveries here? Well, again, borrowing from our insights in the bacterial model, it's just the number of individuals in this infected population over here. That's the number of people here. And we're going to multiply that by how, basically, this is like recoveries per person per day. So you can think of this as, how long does each person take to recover? And so we know that each person takes 13 days. So we're going to get, for every person generates one recovery per 14 days. So you can think of this as one recovery per person per 14 days. That would be how we'd model it for COVID-19. And then if you multiply these things out together, the person is gonna cancel, and you're going to end up with just recoveries per day. So if you multiply these things here, then you just get recoveries per unit time, recoveries per day. And then so putting those two things together, we get the same formula we got in our bacterial example, where it's just the number of individuals in this infected population divided by the duration of infection. Just like in the bacteria case, it was the number of bacteria divided by the average lifetime of each bacteria. That's what was the outflow coming out of bacteria there. So it's the exact same logic. And so with that, I can now draw my links, because in order to generate this formula inside recoveries, then I know that I'm going to need access to the number of individuals that are in the infected population. That's the blue thing that's up here. And I'm also going to need access to the duration of infection. So that's a parameter. So that I'm not modeling how that thing changes over time. I just look it up in a table. For COVID-19, the duration of infection is whatever, 13 days. And so I put in 13 days right here. And then I generate that coming in here. And I have just, for clarity, added the directions on these causal links. So as the duration of infection increases, the recovery rate decreases. And as the number of infected people increase, the recovery rate increases, because you're just going to get more people recovering per day if more people are sick. And remember that there is an implicit, and I can draw it here, there is an implicit negative link coming back from here. We don't ever explicitly draw this, but we have to remember that it's there. And that's what generates this balancing feedback loop. And so this right here between infected population and recoveries generates a balancing feedback loop here. And that is going to counteract new infections. And so as new infections come in and grow the infected population, this process is going to start to shrink the infected population to try to bring it back down to zero. Okay, are there questions about that, about how we formed this formula, or the fact that this is a balancing feedback loop? Is everything clear here? Because things are only going to get more complex as we keep moving on here. So I want to make sure we all feel pretty good at this point. Okay. All right, thanks for a little bit of that feedback. All right, I even got some thumbs up. That's cool. Okay, that works. All right, so so now you know, we want to do a little bit more with this. And so one thing that I'm going to do is, if I'm trying to think about a stakeholder, one of the questions that they might be interested in is, they might not care about this distinction between those who are infected and those who recovered. Regardless of whether you're currently infected or whether you've recovered, you've been touched by this disease. And a policymaker might really want to know just how many people have been affected directly by the disease. And so in that case, I can then maybe create a variable out here that I could use to plot the affected population. And that variable is just going to be the sum of the infected population and the recovered population. And I just draw this thing down here. Now, it's really common to want to sum up variables like this, but what's kind of the downside of drawing what now looks kind of like a heart here is that it makes it look like there's some other potential feedback loops going on here, when in reality, you just added this affected population to help you with your metrics when you do performance sort of analysis later. So when you're doing these kind of summing things here, then sometimes what's good is to introduce those shadow variables that we talked about last week, where you could create a shadow variable for infected population. And these are called ghost primitives in Insight Maker, and a shadow variable for recovered population. These are just copies of whatever is going on inside these variables up here. And that allows me to take this affected population and just put it somewhere else where it doesn't muck up the core diagram here. So I can just put it off on the side somewhere, and then I can still plot the affected population. It'll give me that sum later, but it doesn't sort of confuse the system dynamics that are going on. Okay, so far that is our model. We've modeled the right-hand side, the kind of recovery process, and we have we're keeping track of the affected population. But really, one important part that we haven't taken care of so far is the left-hand side of this, the the infectious process here. So that's what we need to model. So again, before I go forward with that, because this is where things are going to get progressively more complicated, are there any questions that have popped up? Is it pretty clear how we've built the right-hand side of this and how we've figured out this formula? Okay, great. All right, so let's just roll forward a little bit then. So one possible way that we can deal with this infectious process, which I'm about to go into, so I just added it all here to show you where we're going, but now I'm going to pick it apart piece by piece to show where all these things come from. So this is kind of the best guess, our best first guess at how to do this. And we're going to find that there's problems with this that we're going to need to fix later. But this will be an example where we're going to build it, simulate it, and then when we look at the simulation, something's going to look not quite right, and we're going to realize what was wrong and then go and fix the thing that's broken. So our first guess here is, and by the way, this is drawn in Stella, and I'm just highlighting here that in Stella, which is a very popular program for system dynamics modeling, they know you're going to do these summing things so often that instead of bothering with creating like ghost primitives or shadow variables that you have to like create yourself or whatever, it actually has a special variable that is just for summing. And you can create one of those, and then inside it, when you drill down inside there, you can say, what do you want there to add up? And you can say, well, add up this, 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 and that. And it'll then, wrap those up here. So that's all that's what this little plus means here. It's just a little summing junction that Stella's got. All right, so zooming in a little bit on the infectious part, then we've still got our two stocks, susceptible and infected. If I look at the infected population here, then if I think about what goes on during infection, my mental model of what goes on during infection, then I realize that infected people bump in to other people and make them infected too. And so with that in mind, it makes me think that what I should do is I need a parameter, contacts per day per infected person, which represents how often an infected person is going to have contact with other people in the population. And so I could go and measure that. Like I could go and do a study where I put little GPS tags on people who agree to be tagged and see how they walk around and just see roughly, over a day, how many contacts does someone make? And if they're infected, I could say, well, for certain diseases, when there's very low symptoms at first, they may not even know they're infected, and so they just keep going about their day like normal. And so they might have a high infection. But other diseases that really knock people out, then they stay inside, and then even though they're infected, they don't have really any contacts with anybody per day. So this could vary. And so there's a question in the chat. The NBA and NFL do something like that, right? I personally don't know. That's an excellent question. It's my guess that they probably did do an analysis of this and probably could, but you guys might know more about that than I do. But yeah, that you could imagine if you are trying to maintain a population of healthy people, then in your metrics to see like whether you need to step up your constraints or keep them where they are, then you might need to keep track of things like how often do my players that are inside my bubble interact with other people outside the bubble, like whenever they order an Uber or something like that, or order food on Uber Eats or whatever, then those would go into this calculation right here. Yeah, great comment. So that's one thing that I need to figure out. So I just go out and measure that in the real world. And given that I have a way to measure that, then I am going to say, well, then I'll multiply that by the number of people in the population. And maybe then that will give me my total number of contacts per day. So each person contacts this many people, and there are this many infected people that are out there bopping around. And so the number of contacts you get from the entire population of the infected compartment is going to be this total contacts per day. That's what we're forming here, just the multiplication of these two. All right, are there questions about that formula there? I'm not saying this formula is perfect. There will be problems with this formula that come out later, but this is our first start. So does everybody see kind of where this is coming from? Okay. Well, stop me if I'm going too fast. So now, what do we do with total contacts per day? Well, mental model, just, you're just thinking through in your mind, what do you know about infection? Well, just because you bump into somebody who's infected, that doesn't mean that they spread disease. Some diseases are easier to spread than others. We used to think that COVID-19 was spread, a number of different ways. Now people are really focused on the way it spreads through the air. So there's not as much of a worry about it spreading through surfaces, for example. So, these things evolve over time. And in the different ways in which they spread, something that is, you have no, a sexually transmitted disease. If you bump into someone just on the street who happens to have a sexually transmitted disease, you don't have to worry about that, person infecting you if you shake their hand or something like that. So the a contact does not necessarily mean that there is the same chance of infection. And so this is another parameter that, based on the disease, we're going to have to look up in a table here. And so different diseases are going to have different rates of infection. So this infectivity, you can think of this as a probability that a contact leads to infection. So it's like a fraction of contacts that actually generate infections. So we know we have this many contacts per day with infected people, and we've got a slice of them. So this infectivity, this is going to be less than 1. This infectivity is just like a probability that is going to be the small fraction of these contacts per day that actually leads to new infections. And then that there will go into the infections per day flow. And that infections per day flow here, infections per day here, that is just my total contacts per day times my infectivity. And then that flow right there is going to then reduce the susceptible population and increase the infected population. So that's how we're building this this here. Do these formulas make sense? Are there any questions about that? Okay, good. And just this is a parameter here, and this is a parameter here. Good, thank you for the feedback there. So these are set in exogenously. So every disease has got a different one of these two parameters. The rest of these things are systemic endogenous structures, which drive the dynamics of the population. Okay, so if we look at these formulas here, then we notice that there is a feedback loop. And so it might be interesting to figure out what type of feedback loop this is. And so if I look down here at the formulas, and this is something we started to practice on, maybe some of you for the first time, hopefully not, but you know, got to practice this on the midterm. And if we look at these things, we could say, well, infected population has some causal link on total contacts per day. So I look down here, I see total contacts per day, and I see infected population. Well, here I see that if infected population goes up, total contacts per day also goes up. So that implies that this thing is a plus. Here I see total contacts per day. It has an impact on infections per day. So infections per day and total contacts per day. If total contacts per day goes up, infections goes up. So that also has a plus. And then this here, remember that every flow has an implicit positive link to the stock that it's connected, that it's the head of the flow is connected to. So that is a plus here. So this here, that looks like 3 pluses. So what type of feedback is that? Anybody in the chat maybe, or audible or whatever? Good. So it's a reinforcing feedback, a positive feedback. That's right. So this is a positive feedback loop. And so that's all that I'm kind of saying here. Positive feedback loop. So this goes to show that the left-hand side of our SIR model is going to have a reinforcing loop that is going to mean that initially that, you know, you might have heard a lot of people when, you know, a year ago talking about COVID, trying to get people, you know, thinking about the disease spread, they talked about exponential growth. They said there's exponential growth in COVID with every infected person. When they infect someone else, now there's 2 people infecting other people, then there'll be 4, and then there'll be, you know, 8, and so on and so forth. They talk about exponential growth. What they were describing is this reinforcing feedback loop, where initially you don't get many infections per day, but as you get more infected individuals, you get more capability to have even more infected individuals, and that generates a reinforcing feedback loop. All right, so are there questions about this so far? Before we put that together with the other half, simulate it, and then see where we need to fix some bugs. All right, well, as you're thinking about that, let's do a little attendance question. And so I'll put the link here in the chat. And the question is, what does SIR stand for? And you can use either definition for I, the one that ends in ED or the one that ends in SHUS. Either one's fine. And then as you're thinking of that, again, just a reminder, are there any questions about what we have so far? Feel free to bring them up. Okay. All right, so at this point, as modelers, we should start getting excited. We have taken a mental model of disease spread where we're thinking about, like, somebody's diseased, how long are they going to stay diseased, what's going to happen while they've got the disease, how many other people are going to get the disease. These are all things that you could talk to us about individually. And we managed to diagram all of that and put it in one place, in one model. And that's like we have now translated our mental model into a readable, compact form that we can communicate to someone else. So that's cool. And then, of course, the next exciting thing is then to say, well, now that I've translated my mental model into something that a computer could understand, I can now ask a computer, what behavior over time would I get with this? But before I do that, it's always good to make some guesses as to what we think is going to happen. And that will sort of help us debug the computer's outcome, or sort of do a sanity check on the outcome we get from the computer. So what might we be expecting here? So I look at this and I see that I've got a contagion process that's a reinforcing loop right next to a recovery process that is a balancing loop. So I've got a reinforcing next to a balancing. So with that in mind, this reinforcing next to a balancing there, then what might I expect in terms of behavior over time from this simulation? Does anybody have any guesses to what type of curve I might get out? If you think back to our system archetypes, whenever we see, yeah, go ahead. These are the types of answers I'm looking for. They're showing up in the chat here. Right. So these are all exactly where I'm hoping you guys are going for this. We would expect to see some form of S-shaped growth. And so we say, well, what's going to be growing in the population? Well, if we think about this, we're talking about the infected population, that appears to be the thing that's growing. And then, but eventually that infected population is going to be limited by the number of recoveries per day. And so maybe it'll level off. And so we're expecting to see S-shaped growth somewhere in this system here from the growth of the infections, the rapid growth of the infections that eventually slows down. Okay, so let's see if we're right or exactly how the S-shaped growth plays out. In order to do that, before we can go into our simulation, we need to actually put numbers into the exogenous parts that we haven't specified yet. So the endogenous parts are all the formulas. Those are the things that if we know the state variables, we can figure out what the formulas are. But there are a couple of things that are left undone, and one of them are the parameter values. And so for each one of these things, I have to go and ask a doctor, what's the average duration of infection for these days? I might have to ask a public health expert, how many contacts per day per infected person for these disease? And I might have to also ask, a doctor, an epidemiologist or something, what probability, if somebody bumps into somebody with this disease, what's the probability that they'll spread the disease to that other person? And those are the three parameters that we have here that we're just going to put in these three boxes right here, and right here, just constants we put in there. If you want, you can make them sliders and you can slide them around and try different values. And that's something you'll have practice with the homework that's currently out. The other thing we need to do is set the initial conditions. And so initially there's no one who's recovered because no one's had the disease. And here's another important exogenous thing. If we start out with no one with the disease, so if there's 0 people with the disease, we're not going to ever see how the disease spreads because it'll have no chance of spreading. So we are not modeling how the heck the disease got here. We're assuming there's some exogenous forces that brought the disease to us, like an asteroid hit the earth and brought the disease here. Or there's some interesting things with zoonotic diseases, spreading from other animals or whatever. You could imagine building an expansive model that actually does include the rate of generation of new diseases. But we're not doing that for here. We leave that as another exercise. We're just trying to say let's just start simple. And if we start simple, we're just going to inoculate our population with 2 people who have the disease. And then the rest of the population, so we simulate a population of 10,000, the rest of them are just susceptible. They don't have the disease and they are not immune to it. All right, do these make sense? These parameter values and initial conditions that I set here. At this point, we're ready to simulate and see our behaviors over time. So any questions about that? Is it clear what these numbers are? Okay. All right, so we simulate. What spits out a VinSim or Inside Maker or Stella is something that looks like this. We got 3 curves. We've got our susceptible curve here. So the 1 here, remember that 1 means look for the line that has a 1 in it. And our susceptible population starts at around 10,000, 9,998, and it plummets. The infected population, it has this kind of peak here. It rises and then falls. And then our recovered population, it's the line marked with a 3, it then has the nice S-shaped growth. So initially, when you plot this, before thinking about it, that sort of primal part of you looks at that and gets excited, like I see S-shaped growth. this is exciting. I must have done something right because that's kind of what I was expecting. But then when you back up and look at it, then you start noticing some strange things, and you say, is this the S-shaped growth I was expecting? So does it make sense for me to have S-shaped growth in the recovered population? And if I think about it, I said, you know what, the reinforcing loop was reinforcing the growth of the infectious population. I didn't really think about the recovered population really critically. And so I'll get to the question in a second. And then so yeah, the recovered population, it seems maybe that's not what I was thinking about for the S-shaped growth. So there's a question in the chat. Shouldn't it be flipped like the direction? Which are you referring to being flipped? The recovered population or the susceptible population? Or which direction? Okay, all right. And we'll get to that. We're going to talk about all three of these curves. So I was expecting S-shaped growth in the infected population because that's the one that had the so that infected population is the one that had the reinforcing loop on one side of it and the balancing loop on the other side of it. And so the S-shaped growth here didn't seem to show up. And so it's kind of doubting my capabilities at understanding systems archetypes, initially when I look at this. Now, when I look at this infected peak, it looks a little bit like the peaks of infections that we see in known epidemics. So, you get a rise and then a fall. You don't get a rise and then a growth, like this. You get this rise and this fall here. So in some ways, it feels like I did something right, but I don't quite understand what's going on. And as a system dynamics modeler, I need to learn to look for these really sharp peaks. Like, see how it rises up and immediately falls down? System dynamics models are models of averages, basically. They're the average behavior over time. They aren't, so even though real data does have sharp peaks like this, a system dynamics model is really meant to capture the average trend of this infection peak. So whenever I see a sharp peak like that, a lot of times that indicates there might be something weird that I've done in the coding of the model, because I would really expect this to maybe rise up and then softly come back down. And it's not doing that here. So I need to look to see at what might be causing all of this and whether I need to reevaluate some of my formulas. And if I look into, in this case, Insight Maker, if I go into my susceptible population stock here, where I set my initial value for my susceptible population, then I see that there is this checkbox that has been checked down here that is the default value, restrict this stock to be positive values. That there ends up being a bad thing, because in some ways you say, well, that makes sense because I should never let the number of susceptibles go negative. I need to always have a positive population. But the reason this is bad is that if I've constructed my formulas correctly, then there will never be a chance that my susceptible population will even try to go negative. But if you look at the susceptible population, that's this gray line here, notice it starts at 9,998 and it starts falling and then it never rounds off. It plummets and just crashes into zero here. And at this point where there's this sharp corner, that's Insight Maker or Vinsim or Stella that is artificially saying you can no longer take any more out of the susceptible population. And what that will, as a side effect, do, it will stop the infected population from growing. So that's the reason why you see this sudden sharp stop in growth of the infected population. This is not coming from the S-shaped growth that I was expecting to come out of it. This is coming from this weird artifact that comes out of Insight Maker or Vinsim, artificially restricting my susceptible population from going to zero. So that indicates that what I really should do, if I want to make sure that my formulas are correct, is I need to get rid of this checkbox. and I need to go back and create a new formula or a modification for my infections per day formula so that this thing doesn't ever have the chance of trying to go negative, so that maybe it naturally rounds off. Because that's kind of what we would expect in real life, is it would naturally round off. Like there's nothing out there where you'd suddenly use up all of the susceptibles and then suddenly there'd just be a sudden change in the way a disease works. Like this is effectively what it's saying here, is it's as if the disease works one way until something special happens and the disease just starts working a different way. That's not really what should be going on here. Our formula should be more graceful. So if we go back and even if we don't quite understand exactly how to fix this, this tells us where we need to look to make a fix. So whenever you see sharp changes in your behavior over time plots, you need to evaluate whether those sharp changes make sense, because endogenous forces inside a system dynamics model, well, it's extremely unlikely for them to generate very sharp changes like that. So if we go back and look at our formulas and look for fundamental problems here, then we can stare at this for a while, and then we use this to then query our mental models to say, like, what are we missing? What did we leave out? We know better than this. And if I do that and I stare at this a little bit, then what I notice here is that the infections per day depends upon the total contacts. The total contacts depends upon the infected population. Neither of these formulas depends upon the susceptible population. So what this is saying is that the number of infections per day is driven only by the number of infected. And that doesn't seem right. It should be that the number of susceptibles affects the number of infections per day. If there's nobody susceptible in the population, then it should be very hard to generate new infections per day. Or, if there's just a few susceptibles, like if you've got a population of 350 million and there's 10 people who are susceptible, technically the disease can spread to those 10 people, but it's going to be really, really hard to find those 10 people. So it's going to be much harder for any random infected person to bump into one of those susceptible individuals. And by the time an infected person finds one of those susceptible individuals, they might have recovered and they might not be infectious anymore. So that's what we're missing, is the dependence, the infections per day's dependence on the susceptible population. We are expecting to have some sort of causal link that relates susceptible population to infections per day. Because we don't have that, then that's what's causing this sharp peak here, is because this susceptible population is sucked into the ground because the number of infections per day is free to grow, even though the number of susceptibles out there is declining. So even though technically it should be a lot harder for the infected population to find new people to infect, this is not properly modeled here until the extreme case, when the number of susceptibles goes to 0. And at that case, it just artificially cuts off this flow. We need a more gentle cutoff to this flow. And there's a question in the chat: do SIR models include vaccinations ever? That's a great question. You could have an alternative flow from susceptibles automatic or over to the recovered, which are way over on the other side of the screen, and a flow rate that's coming out of that. And that flow rate would reflect the rate at which you can vaccinate people. And so you'd have two ways to get to recovered: by being infected or by going through vaccinations. And that would be a different type of model. That would be a modification to the SIR model. That'd be one way to do it. The other way to do it is if you want to say, like, well, what fraction of it, and we're actually going to get to this in just a second, but what fraction of the population has to be vaccinated in order for us to reach this magic point where the susceptibles are protected? You can change the initial conditions of the model so that you start the model with higher numbers of recovered individuals, and those are like your vaccinated individuals. And right, we're going to talk about herd immunity in just a second. All right, so so that's what we need to fix here is this infections per day flow here, so that we end up making this sort of plateau in the recovered population occur for the right reasons, but and we recover this idea of this like herd immunity that was just brought up in the questions here. So right now, this model, without modifying it, has no ability to produce herd immunity because it will always bring the susceptible population to zero. And so that basically means there can never be herd immunity. So we cannot study herd immunity with the model that we built. The model that we built probably works when for early on in a disease spread. But for later in disease spread, when it's harder to find susceptibles, our model will not be accurate. And that's why we need to fix it. Okay, so are there questions, any questions that I can get to here? It might actually be just more helpful to see the kind of right model that we're going to fill out here, which will be the complete SIR model. All right, so we're just trying to make it so that the infections per day depends upon both the infected population, which it currently does, and the susceptible population, because that's what our mental model tells us it should. So this is the expanded model that we're going to walk through here, and it looks, the right-hand side is identical to what we just had. The left-hand side looks pretty darn close, except we've now added these blue links here, which provide a pathway on which the number of susceptible population is going to affect the number of contacts per day. And so let's drill down into that. So the idea here is we don't care about all contacts per day. If an infected individual bumps into another infected individual, we don't care. There's no chance that disease is going to spread. If an infected individual bumps into a recovered individual, we don't care. There's no chance that the infection is going to spread. We only care about the number of times an infected individual bumps into a susceptible individual. And that's where we bring these two populations together. So we are going to create a variable called dangerous contacts per day. And this dangerous contacts per day will ultimately be the thing that in the infections flow is going to be what determines the number of individuals moving from susceptibles to infected. So the formula we have up here is what we have down here, which will be dangerous contacts per day times the infectivity that we already talked about. So how do we form dangerous contacts per day? That's what we need to figure out how to model. So if we think about it, we had total contacts per day already. And so we just need to take total contacts per day and multiply it by the fraction of those contacts, that's what the FR here is, fraction, that are with a susceptible person. So so that's what we're building out here is, you know, we already know how to build total contacts per day, and then we need to then figure out what fraction of the total contacts are dangerous. And the way we get to that is we need to then figure out how to model that susceptible fraction, and we are going to use a modeling assumption. So so you basically could say, you know, like at this point, this is the assumptions fill in data that you don't have. So the idea here is that you could say a random infected person bumps into a random susceptible person. What are the chances that that random infected person, a random infected person bumps into someone else? What are the chances that that someone else is susceptible? Now, if we lived in a quarantined world where everybody who is infected immediately gets detected and gets moved off into a special area where they only can interact with themselves, then we know that there's no chance that you're going to bump into anybody who's susceptible. And so that would be one assumption. And so we would set the fraction susceptible here to 0 if we have a really good, you know, quarantine policy. But if we don't have a quarantine policy, then we might make what's known as a well-mixedness assumption. And what we're saying when a population is well-mixed is it basically means that the fraction of susceptibles in the population matches the probability that any random encounter is with a susceptible individual. So if no one's quarantined out there, everybody's bumping around, and 40% of the population is susceptible, then what we're saying is we're making the assumption that if I bump into someone randomly and I'm infected, there's a 40% chance that that person is susceptible because there's 40% of the population is susceptible. That is a so-called well-mixed assumption. We're assuming the population is well mixed. We're not quarantining people so that infecteds only interact with infected and susceptibles with susceptibles and so on. So under that assumption, then all we need to do is divide the susceptible population, so however many are in the susceptible population, by the total population, and that will give us the fraction, that's what the FR here, of susceptible. So if 40% of the population are susceptible, then this will be a 40%. And then we are going to use that 40% directly in the fraction of contacts that are with us susceptible. We're basically just copying that thing over so that the fraction of contacts here with susceptible is just going to be exactly the same thing as what was calculated over here. That's all I'm kind of saying here. And then that fraction is going to cut down our total contacts per day to give us our dangerous contacts per day. So here's all of the contacts that an infected person will have per day. Here is the percentage of the population that is susceptible. Combine those two things together, and then we have dangerous contacts per day. And that is what we actually use in our infections flow. And that's these are the formulas here for that. And these are our old formulas over here. And so that gives us a new loop, a depletion loop right here, along with our existing contagion loop. And then we had our old loop over here, which is our recovery loop. So now we have 3 loops, not just 2. We have a depletion loop and a contagion loop, and then we have the recovery loop over here. And so we actually have 3 expected S-shaped growth curves. There's this one, which has got the reinforcing and the balancing here. So this is going to be where we'd expect an S-shaped decline in susceptibles. So this is going to be the process here where the susceptibles are going to start high, they're going to start plummeting like a roller coaster, and then they're going to slowly roll out. So that is going to fix that ugly corner that we have there. And then on the other side, the one we already had, the recovered population, that's actually what this recovered imbalance is. That's going to give us the S-shaped growth in the recoveries. So if I take this thing with all of the initial conditions and the parameters as set before, I now get a behavior over time plot that looks exactly like I was expecting. I get a susceptible population that slowly, and this is, goes down through here, it slowly falls and then it rounds off. I get a recovered population that rises quickly and then rounds off. And I get a nice flat or a nice curved infection peak that looks much more like the infection peaks, the average infection peaks that I get in real epidemics. So this is exactly what I was expecting. And now, adding to the realism, if I look at what happens at the equilibrium here, I see that the infection is going to die out before everyone is infected. There are a small fraction of individuals that have so-called herd immunity. So this model actually captures the ability for the difficulty in finding susceptibles and that preventing them from getting infected. And so that generates this herd immunity, which is why the number of recovered individuals does not actually end up meeting the total population when things settle out at equilibrium here. There's always this gap here, and that gap matches this gap down here. And so we would like to know how many of those susceptibles escape infection, and how does that relate to the parameters of the disease spread? Because then that will allow us to predict how bad things are going to be, how many people are actually going to be affected by this disease. And so that is what we're about to sort of finish off with, is this an analysis of what it means to be kind of, in this herd immunity here. So yeah, I was about to ask for questions. So a question popped up here. So what is highlighted? And so what is highlighted is what the other graph was showing. So the highlighted here is, this is the area underneath the infected curve. This is effectively the number of recovered population. So if you were to take the area underneath here, that would be the number of people that recovered. So these were the number of people that were infected at any time. If we add up how many people were infected at all times, we get the number of people who recovered. So this distance here is effectively the area under the curve, which is what's highlighted in blue there.
Sorry, just for clarification, I was mostly asking about like how this as a whole is, because like the previous slide, it had the graph over it in the middle. And
okay.
Yeah, so I was wondering like, how does that graph like show that the simulated graph is the same, or like proves it as like being, okay, so that's, yeah, is that, okay, that's what you're trying to, okay, the arrows, right? Okay, we're good.
Right. So yeah, this, which is real data on 2014's Ebola epidemic, this is a plot of new cases per week. So this is a plot of the number of infected at any given time, effectively. So that's the number who are currently in that infected bin. And so it is modeled, so that's modeled by this curve 2, which is the infected population.
Okay, thank you so much.
So any other questions about that so far? About how we got to a working SIR model? Okay. All right, so this is the fun. So we've taken our mental model of how we got disease spread. We have managed to build a behavior over time, which actually looks like real behavior over time. And now we can start analyzing it. We can analyze it mathematically in theory, or we can do scenario testing inside simulation. So let's take a look at a brief analysis, and then we'll do some scenario testing. So one thing that we would like to know is what conditions determine how outbreaks spread, which in another way is how, trying to understand how do the parameters of each disease predict how many susceptibles will actually escape infection. See, that's the endogenous versus exogenous. Without this model, I might say, for any given disease, I have no idea how big herd immunity or how big the protected population is going to be. And I might think it's just random. I might think that, if you unrolled the universe again, the number of people who would escape this disease might be totally different than the number of people that will escape the disease, in this reality. But what this is telling us is that if these hypothetical models are correct, then we can actually predict for every single universe where this disease is the same, has the same parameters, what fraction of the population will actually escape this disease. So how does that work? Well, the 3 parameters, the exogenous parts of this model, are the infectivity, the contacts per day per infected person, and the duration of infection. And if we did a little bit of a mathematical analysis, which is a little bit outside the scope of this course, then what we'd find is that the product of these 3 parameters form the so-called basic reproduction number, or R0, which you may have heard about on the news or in movies or in fiction or whatever, is that, and this is the product of these 3 things. And so where does it come from? Well, the basic idea behind the basic reproduction number is we want to say, well, under what conditions do outbreaks spread? And so, well, we know that a single individual is going to have this many contacts per day per person. And these will be the number of infections that will be generated by this many contacts per day per person. Now, R0, where the naught comes from, is we're considering the world at the beginning of the infection when everyone is susceptible except for like a tiny handful of people. That's where the naught is. RT, which you might have heard of, that has to do with once the infection's rolling. But R0 is right at the beginning, you inject somebody and then it starts spreading. And so at that point, we don't need to worry about dangerous contacts, because that one person, every contact they make is going to be a dangerous contact. So that's why it's just this product here. So this is how much a single person is spreading the disease, how fast a single person is spreading the disease while they're infected. So then the other thing that we care about is how quickly they get well, because once they're well, they stop spreading it. And so that's where that other parameter comes into play here. And this here is how quickly they are getting well, how quickly they are being removed from the infected population. And if we compare those two rates, then we know whether a disease is going to spread or not. Basically, if at the start of a disease, when you first infect a population, if the infection rate per person is greater than the recovery rate per person, then the disease is going to spread. So where does this R naught come into play? Well, if you take this duration of infection and you move it to the other side of the equation, then you're saying that if this product here is greater than 1, that's what means the disease is going to spread. If it's less than 1, then that means no big deal. You infect somebody, they're going to get a couple of people around them infected, but they're going to recover so quickly that the fire is going to die out. It's kind of like in a wet forest. If you happen to, accidentally, light a fire near a tree, it's going to die out before it has a chance to spread to a lot of other trees. But in a really dry forest, then a tiny little spark has enough to catch the whole forest on fire. This sort of determines if your forest is a dry forest or a wet forest. So that's what this basic reproduction number is. Now, there's a bunch of different ways you can interpret this basic reproduction number, and I'm not going to go into a great deal of detail here just for time's sake, but basically the interpretation that you'll hear of R naught in most movies and media and whatever is the average number of new infections caused by each infected individual during his or her infectious period. So if you get infected on average, while you're infected, how many other people are you going to infect? That is a way you can interpret what this R naught is here. So if this R naught is less than 1, then that means that every time you get infected, you might infect someone, but there's a good chance you're not going to infect someone. So that's what it means to have an R naught less than 1. And so the unlucky individual who gets infected by you, they might not actually get anyone else infected. And so the fire will die out before it spreads. So that's where this kind of R naught comes from. And so that's kind of what we're summarizing here. Now, why am I going through all of this sort of thing? Well, now that you know that R naught is determined by these 3 variables, infectivity, contacts per day per infected person, and duration of infection, that tells us as policymakers that we actually have levers that we can work with in order to help control the spread of disease and to predict how diseases will spread if we can measure these things separately. So a new disease is found. A policymaker, before actually letting the disease go wild, we can measure these 3 things separately before the disease actually hits a population, and we can estimate whether it's going to spread. We just need to estimate infectivity, contacts per day per infected person, duration of infection. And furthermore, if we can get people to change their behavior so that they can reduce these things. So for example, we could invest in medicines that reduce the duration of infection. We could invest in media campaigns to allow people to get people to wear masks, for example. That would affect the infectivity. We can convince people to social distance. Well, that will maybe affect the contacts per day per infected person. When you hear public health experts tell you those things, that's them attempting to control technically the RT, but the idea is that they're trying to control disease spread, because it turns out disease spread is all about these 3 parameters, and that's what we get from the SIR model. And so for a bunch of different diseases, they've calculated R naughts, and the ones that are higher mean that they spread faster. The ones that are lower and less than 1 mean that we don't worry too much about them because they take care of themselves. So back in April of 2020, I think COVID-19 was right here with a lot of uncertainty about this. And I haven't looked at what the R naught estimate is now. But that kind of, but what you know here is that it turns out that the fraction of individuals who escape the spread of the disease is 1 divided by this number. So if, for example, the R naught of COVID was 5, then that would mean that 20%, so an R naught of 5 is going to mean that 20% of individuals will escape the disease at herd immunity, which means if you let things go to herd immunity, you're going to need 80% of people to get the disease or to get vaccinated. So that's how we translate from R naught to how many people need to get vaccinated is this idea that you take whatever the estimate of R naught is, which you can get by estimating these 3 things. You do 1 divided by that. That's how many people are protected at herd immunity. And then the whatever's left over, those are the people that either need to be infected or need to be vaccinated. All right, so that's basic epidemiology with an SIR model. I want to spend the last couple minutes doing a little scenario thing to kind of show you where this flatten the curve comes from. Are there any quick questions? All right. All right, so this last example here basically threw in here, but I think it's a nice example that comes out of that textbook that I said that has the infected population. That's the reason I use infected and not infectious. But great article from last year about how computer modeling can help us do scenario planning, basically. I'm not going to wax philosophical too much about it, but I posted this article on the Canvas site and encourage you to take a look at it. And basically an example of that comes out of this textbook by Ford, where what they did is they added in to the SIR model. So this would be a great sort of thing for you to think about for your final projects. Take a model that we've looked at in class or in the textbooks and add something to it. In this case, they want to simulate the sort of effect of quarantine on a population here. And so they've taken the normal SIR model and they've added a contact avoidance loop, where basically there is a lookup table, which basically shows triggers for when you implement quarantine based on the number of people who are currently infected here. And when you implement quarantine, it is going to affect the total contacts per day. And so what they ended up trying here was different lookup tables that implement different types of quarantine. And what they show here is this here is the no quarantine case for the affected population. And when they have the contact rate due to quarantine by social distancing, when there are 2,000 infections, you get this affected population. And when they have the contact rate at 1,000 infections, then you get this number of affected individuals. And what I'm trying to show here is that for all 3 of these policies, do nothing, have the contact rate at 2,000 or have the contact rate at 1,000 infections, there's not a whole lot of difference. So the first lesson that we learn by this is if you're going to quarantine, you got to do it super early. You do not wait till, look at Australia. When they get 1 infection in one of their states, like imagine all of Arizona, you get 1 infection. In Australia, you get 1 infection, they shut down the whole damn state. Sorry for my language. Here, we wait for tens of thousands of infections. And what this sort of model suggests to us is that will not have an impact on the total number of people who are infected over time. It just won't make much of a difference. But what we can do is if you're not willing to go to the drastic extremes of quarantining really early, it does make an impact to quarantine late, but the impact it makes is on the infected population. And so here is the no quarantine, here's the quarantine kind of late, but eventually here's the quarantine a little earlier. And what you can see is this infected population gets flatter and flatter. It gets longer. And that's the reason why ultimately you don't change the number of people who are totally affected, but the number of people who are infected at any given time never goes above a particular level. And that is the whole flattening the curve thing. It's that if you can keep this infected peak under your hospital capacity, then you can weather the storm. And that's the reason why, even if you haven't quarantined early enough, there still can be some value to quarantine. All right, so we're at time. I am going to take questions, but I want to make sure I give you your last attendance question here. And then, and that question here is, let's say, name one of the 3 factors that goes into the calculation of R0. Okay, and if you look at the rest of this slide presentation, which I didn't get a chance to go through, but it just basically had a bunch of bonus information that includes a bunch of other types of models, like an SIS model where nobody recovers, they just go back to being susceptible. There are combinations where you could have an exposed group that then becomes infectious and then becomes recovered. And you can have other sorts of combinations where they become susceptible again. There are all sorts of crazy things you can do. And if you go to Wikipedia and look under compartmental models and epidemiology, or just under epidemic model, you can find a huge list of them here. And those are going to be, if you scroll down into that, they're going to be specified in Wikipedia as these mathematical expressions. But I'm hoping you're starting to see that whenever you see something that looks like this is a flow. And the thing that's in the numerator, if you want to call it that, of the derivative, is a stock. And so you could build a stock and flow model of all of these. You could make a final project where you investigate the MSIR model, for example. And which one of these do you use? The idea here is it's going to depend on what question you're asking, and that's kind of the art of model building. So that's where I want to leave you. I'm over. If that's all I got for you, so you can feel free to pop off. If you've got any other questions, I am happy to take them now. Otherwise, don't forget to read that chapter for Tuesday. And even though it's not talking about infections and disease, it's talking about the spread of an iPhone, for example, through a marketplace. Think about how this mental model of disease spread helps you understand the adoption of things through a market. So that's all I've got. So does anyone have any questions? I'm happy to stick around. Otherwise, I do have office hours after this. All right. Okay, so I see a question in the private message here. If it's a private question, then, oh, it's the one that's up there. All right, so I will reread that question up there.
Oh, I guess I could talk now. Sorry, yeah, that's just I'm just trying to get some data for my my pitch playoffs here for Venture Devils, and so maybe like next class if I could throw that in there, if that's okay with you.
Yeah, I think that's fine. If you want to post that into the chat, I think that is that's totally relevant and fine. If you want to also post it as a discussion post, or if you want to do the @channel in the Slack, and then that way it'll actually send a notification to everybody. I'm okay with that.
Okay, cool. Thank you.
Mm-hmm. Anything else from anyone else left over?
It might be more related to your office hours, so I can wait until you open that room.
Okay, sure. I technically open it at 4:30, so I will definitely be there at 4:30, if not a little sooner.
Okay, well, it was pretty quick, actually. It was mostly just letting you know that on our topic proposal for the final project, I had given you a comment back